Yeah, there's a lot of frustration when doctors don't have answers. And you have to appreciate, for the traditional allopathic doctor, their lens is diagnosis and treatment. And typically that treatment comes from a chemical, a pharmaceutical, if not a surgical intervention.
You have people that have these varying degrees of, dysfunction, but because the lab ranges say it's okay, typically our doctors are going to say, oh no, you're fine, the lab says it's normal.
Many medical doctors set out, they truly want to help people. They want to help people get better. And the solutions to any of the diagnoses that medical doctors learn about are medications. So they're really not taught nutrition, they're not taught lifestyle solutions, they don't learn about supplements, and they don't learn about natural solutions.
You have these extremes that the general medicine population is used to diagnosing, and if you don't fit within those labs, then they say you don't have anything wrong with you.
So testing for adrenal fatigue, I think it's really in the Stone Ages. I don't think that there's one test that I would say this is the test you need, because it's so much more complicated than that.
So the doctors are lacking the tools. They don't have the tools to help patients make behavior changes. They don't have the resources available to them because they're confined by 15-minute visits governed by insurance companies. And they have patients that come in that are giving pushback, that are arguing and saying, well, I don't really eat that bad. I really don't need to do this. So there's that confrontation, and doctors that just get burnt out and say, I don't want to argue with it anymore. That's fine. Do what you want. Just take these meds. Come back in 6 months, and they'll sign off on the chart.
Western medicine does some things very well, like if you're having a heart attack, if you're having a stroke, if you're, you break your leg, you need a surgery done. But with chronic disease, the idea that a medication that blocks processes can give you a good result in the long term, it just doesn't make any sense.